Hey everyone, welcome. This is Angela Love-Zarenka with Lactation Education Resources. Thank you all so much for joining us today. I have the great pleasure of introducing Nikki and Nikki, and they are being joined by Jania Williams. And I will say thank you for joining us and again. And Nikki, I'll turn it over to you.
Hey y'all, welcome back.
Everyone. Yes. Happy April.
Woo, we made it. We made it this far. All right, let me start at the beginning. I am Nikki Killings, Director of Equity, Inclusion, and Belonging at Lactation Education Resources, who so graciously presents this to you all twice monthly. And I'm a private practice lactation consultant in Florida, as well as a perinatal equity strategist, helping organizations get it together in terms of equity and inclusion inside and the way that they serve their communities. I am joined by my good troublemaker, Nikki Hunter Greenway.
Hey everyone, I'm Nikki Hunter Greenaway, better known as Nurse Nikki. I'm a family nurse practitioner and a lactation consultant in New Orleans, Louisiana, where I'm in private practice at Bloom Maternal Health, where we do postpartum and women's health home visits, and now telehealth. So welcome everyone. And we have a guest with us today. Miss Jania Williams, please introduce yourself.
Good afternoon, everyone. I am Jania Williams. I am a lactation consultant. Also, I am a program director for one of the P2 programs at North Carolina A&T State University. In addition to that, I co-coordinate our hospital at Cone Health's community doula program, as well as I love doing Black maternal child health research in conjunction with Dr. Stephanie Baker of Elon University. And thank you all for having me today.
Yes, we have lots of hats. Stay tuned for a future episode where we'll talk about pairing your IBCLC credential with
all the
a billion other jobs, with all the things. Because all of us are multitasking. Today, thank you, Jania. We're so happy to have you with us. Today, our topic is our quarterly check-in with how to become an IBCLC. Each time we try to put a little bit of different lens on it. Today's lens is about been there, done that. So, talking with and about having been in the field and how to ensure longevity in the field and what that looks like. And what are some tools and tips to make sure you stick around in the field, making a difference for a long time. But first, how is everybody doing? Quick check-in, not only with us, but with the audience. Please talk back to us in the questions box, as Angela has shown you how to access. How are y'all doing?
Happy Black Maternal Health Week, everyone. As we dive into this week and all that, there's so many events. It's like one big, I don't know, like, and we can go to all of them because everything's virtual. It's slightly overwhelming. We usually have like some virtual events, but now we have like so many. So it's really fun to see how this week has expanded and the people are really being creative with it.
I agree. How you doing though?
I'm okay.
Okay, all right. She's giving us what she wants to give us. That's my
yeah, I'm fine. I'm fine. It's rainy weather here. It is that rainy season here in New Orleans, so we have quite a bit of flooding that happens. We're on day 2 of flooding, where the streets flood a little bit, up to your knee a little bit. So we are here navigating that and still doing visits and trying to see mamas and babies and all that jazz. So we're good.
Get that. You know, I don't think I've ever shared this with you, Nikki, but the area I grew up in Florida had a pretty poor drainage system. And so every time it rained, there was knee or hip high water in the street. And we played in that water. And I'm sure.
No, ma'am. That's not. We don't.
The more we know now.
I'm just saying. At some point in life, I'll probably be suffering the repercussions of playing in that water.
You're going to have that third leg that you...
Something is afoot, probably literally. All right, Jania, how are you doing?
Doing okay. You know, just I think like everyone who is parenting in the midst of a pandemic and working and having your own things going on. It's just trying to stay afloat and trying to fit in that self-care, because that's definitely something you need. I think everyone needs, regardless of what profession you are in. But I'm always like, what are we going to do? Like, I know y'all check in with me all the time. Like, what are you doing? Are you taking self-care? And I love and appreciate the two of you for that so much, because like when I go silent, that's when people come creeping into my inbox or text me like, hey, everything okay over there? So thank you for doing that, because that's the push that we should all be doing for each other right now.
I would agree. I've been on that a lot lately. If y'all have heard me in different spaces talking about staying connected to each other. And I think we had this assumption that by this point we would be back okay, especially with everyone getting vaccinated and it's a little safer for us to go back out and practice, that all of us would be at a place where we could just exhale and be okay. But we're not quite feeling okay because we still got so much going on, and there's so much, I don't even know what the word is, Nikki, but you captured it in abundance of opportunities to touch the world and the world to touch us in access us in ways that's we're not used to.
Right.
Yet we're not truly connected in the ways that feed us. And so it's a really interesting space to be in, and we have to really slow down and check in with ourselves and make sure we're okay and do the things that do feed us. And some of that involves unplugging from the Zooms.
Yes.
Yeah.
Unplug to charge. Unplug yourself to recharge.
It's not, intuitive, but it is so true. It is so true. Yes. So please, audience, do that. Let us know how y'all are doing that. Let us know that you're okay out there. I'm checking. The folks behind the curtain are texting us. They keep us abreast of what you all are saying in your questions box. So I will make sure to chime that in as I see it. But take care of yourselves out there. I'm okay. I'm hopped up on caffeine right now, so doing a lot, real hyper. But otherwise, I'm feeling like everybody else, and trying to make sure I'm steadying myself. Some folks are prepping for the exam. Ooh, it's getting close, y'all.
Yeah.
End of the month. I think we're 2 weeks out.
I was like,
I feel like we should know this.
We should better.
But it changes. Here's the thing. This is not our normal schedule, y'all. Can we just say that this is not the normal schedule for IBCLC? And it's kind of thrown us off. Like if we don't have updates on our phone, every day of what's going on, I think some people are confused, and we try and demystify this as much as we can, but we don't know what we don't know.
Indeed. Hello, Ohio. Hello, Washington. Thank y'all so much for joining us. Let's see. 3 weeks left before I graduate with my DNP and FNP license. Congratulations.
Ooh, yes, congratulations.
Woo, Arizona's in the house. Listen, y'all are doing big things. I'm super excited for you, but you check in with yourself. All right, make sure you're okay. Pennsylvania is trying to stay afloat. Y'all are out here. We appreciate your being with us today. Y'all ready to jump in?
All right.
Ready.
Let's do it. All right, I'll keep sharing updates from the questions box, but let's see. What would you all say? Nikki, we still don't know how many years you've been in this week.
I've been since 2017, y'all.
Oh, we confirmed it. This is her fourth year.
Is it? Oh, okay. Well, here's the thing. I need to recertify soon, and that's why I'm here to learn from y'all about. First, you're probably gonna have to convince me to recertify. Second of all, no, I'm just kidding. You can't be Nikki and Nikki IBCLC with one not IBC. But I do think I have to, like all the different ways. It sounds like there's so many ways, like places to get your certs from, and just tell me about the struggle, because I know it's real.
Yeah. Well, Jania and I are both certified in 2015. But we've been doing this work longer. We've been in this thing a little bit longer than that. I know for me, that was my 5th year in. The year I became an IBCLC, I'd already been doing lactation work for 5 years at that point. So this is my 10th year, going 11th in the work. And recertifying was a beast. Even though we didn't take the exam, and moving forward, folks won't have to take the exam to recertify. And I know some of y'all who just took it are like, hallelujah.
Nikki and I.
I'm still saying hallelujah 6 years later. I don't have to take that test ever again unless I want to.
Baby.
Woo! Appreciate IBCLC for coming to that
Right.
conclusion.
Yes.
Oh, for sure. That was the
Yes.
determining factor. I knew I was not going to recertify if I had to take that BCLC exam again. Not to scare folks out there. I'm just a horrible exam person. And this the anxiety. I lost like 15 pounds from just not eating or going to the bathroom, like preparing for this exam, like the nervousness. And I knew the stuff. It's just a matter of sitting down for those hours, keeping my attention deficit in order, and things like that. These are real things that I think sometimes can be barriers for folks to recertify. That's probably, maybe, I wonder if a slew of people, like, okay, I can do this now if I don't have to take the exam. So maybe more people, I wonder if that is a determining factor.
I think that would be a determining factor for sure. I was, talking to students earlier today, and I was like, hey, I want to talk to you all about getting ready to prepare for the exam, as well as remember, you guys have to recertify. And I said, I know it is very difficult to study for this exam because it's more of, we know, like you said, Nikki, like we know the information that's on there. It's the strategies that we would have to use to actually take the exam. That's what, to me, that's what most of this is. How strategic are you with figuring out how you, one, take tests, and how, two, you can take this exam? Because there aren't trick questions. They're very black and white. And then, because we work in the field and you're getting clinical hours, sometimes it's a gray area, and we know that we can use this and this, but that exam is very black and white. So I even told my student, hey, before you sit for the actual exam, try not to do any clinicals at least 30 days out, because that's what's going to mess you up right there. Because you're going to be like, well, in the clinic, we did X, Y, and Z. Don't do that. It's like, I can assure you, if I had to take the exam again, like you, I may not have those additional letters behind my name because I'm not a good test taker. I was pregnant and morning all day sickness last time.
Yes, yes, I understand.
Yes. Yeah. I think that there's a lot of factors. I have Angela. Angela's giving some insight to us. You'll speak up anytime, Angela, if you want to share that publicly about what impacted the decision to move away from exams. But one thing for me that was really challenging was that the cost was the same. I had to pay this around the same to pay to recertify, whether I was doing it by SERPs or by taking the exam again. And after I'd paid for all those SERPs over the years, it was a difficult decision to make. Then, it was a time value of my money, or value of my time, type of equation. And that was tough.
You're exactly right. And that's definitely some of the advice that I want to hone in on today. What I do is when we have like Black Maternal Health Week, when we have IBCLC Week, all the free things, I like a good free 99. So I attend all of the free things. And then, my certificates, and because I live my life in a spreadsheet and my friends think it's hilarious, but I have all my SERPs lined up in a spreadsheet. And after I'm finished, I put it in there, how many SERPs it was, so that I don't have to dig around. And like when I'm getting ready to key in things for recertification, it is all right there. And I'm also a holder of what I call receipts. So I print out those certificates and I also download them and have a folder on my desktop that I can go back to, and it's backed up on my Google Drive in case something happens.
Right. This is spoken like a person who has lost a file before because she didn't save. Have you?
Hello.
That is very smart.
Y'all new school might not know about that, but back in the day, we used to lose
lose a floppy disk. You heard me?
What? Whole dissertations lost.
Lose a USB. I know y'all don't know what the USB drives are, but these are things that we had on our keychains, and they would go. That was our world coming with us everywhere, and lose your world.
You don't. A floppy disk is that symbol that means save right now. That actually was a physical thing. It wasn't just a symbol. It was
back in the day when there was no autosave. Come on now, come on. This is a whole nother webinar.
All those PowerPoint presentations for undergrad on those floppy disks.
I lost my whole dissertation in college. Whole dissertation.
Many people did, yes. So we're a little scarred. So we save a lot, save on the cloud, save it physically, print it down, paper folder.
Exactly. I absolutely agree with all the free things going to those. Just a shameless plug. New Orleans Breastfeeding Center is having a breastfeeding grand rounds tomorrow night. It is about helping teens that are providing support for teens that are breastfeeding, and you will get your serve. So that's something like tuning into things like that. Different breastfeeding groups, sometimes they are able to get serves and they'll have those things. So please, it's not gonna come to you. This is something that you have to go forth and you know, people post about it, but you do have to do some digging for yourself. If you're truly, you know, budget friendly, you want that stuff, go for it.
Yes. Thank you so much for mentioning that. New Orleans Breastfeeding Center is a friend of LER. LER does provide those SERPs to attendees. So it's real. Come through, free, phenomenal learning. How often are those, Nikki? Are they about once a
They're
quarter?
quarterly. We've been
Yeah.
thinking about having them more than that because I mean, it's grown so much. It's grown so much, but they're really good.
That's awesome.
Those are phenomenal ideas. I think that there's really some great wisdom in identifying free SERPs. You need 75 over the 5 years to recertify.
Yeah.
Please keep them because people like me go scrambling back through old emails at the end of 5 years trying to. I hadn't learned from, like my friends here did, about printing down and having various versions. I'm like, oh, I'll remember that. Or I keep every email, so I'm gonna just go back through my email and then I can't remember the name of the conference. Yeah, all sorts of things happen. So yes, be on the lookout. New Orleans Breastfeeding Center is a fantastic one. Let's see, Angela's sharing with us a fantastic opportunity tomorrow. Angela, can you come in and tell us about it?
Absolutely. LER is sponsoring and hosting a webinar Thursday, April 15th from 6 to 8 p.m. Pacific time. And it is entitled It Takes a Village. And it is being sponsored by the Community Doula Alliance, the Community Doula Program, Health Equity Alliance, NAACP, Samaritan Health Services, and Uplift Lab. For those of you who've attended LER presentations in the past, Dr. Jonathan Snowden, who did a wonderful job with the panel on the COVID vaccine, and COVID in general is actually part of the Uplift Lab. So please do enjoy and join us. I'm uncertain if continuing education points will be available. I'm going to say no. If I'm wrong, I will let you know. And yes, I will put this in the chat. A lot of people are asking, so I'll put this information in the chat. If you go to our website or look on our social media, you will get the link. It is a GoToWebinar link. You sign up just like you did today, and you will be able to join us. So thank you.
And that is 6 to 8 Pacific. So then you can also hop over to the New Orleans Breastfeeding Center event afterward. You can attend both and get you at least one cert. At least one cert. But also, if you all don't have a way to celebrate Black Maternal Health Week, that's the event you want to attend for sure tomorrow to make sure that you get in some sort of celebrating and honoring the week. Other avenues for free certs, LER's got some. Don't we have one right now, Angela, by Laura Wilson?
We've got a couple right now. We've got Laura Wilson's. We also have our annual review from the previous couple of years that Sakita Lewis-Johnson does a beautiful job. So we do have free SERPs on a very regular basis because we know how hard it is to be able to collect those SERPs. And yes, do print your certificates, save it on your hard drive, save it on that floppy disk, whatever works for you, all the things.
Great idea.
Y'all.
Don't you judge us, Angela. Don't judge.
I know. I was like, oh no. Everyone's gonna start living their life in a spreadsheet and Google Drive.
Yes, but they're so good. Here's the reason why. It's because when you go to recertify, you have to notate where you got each of those 75 hours from. You got to enumerate them, tell about each of them. Another cool place is if you are presenting places, you get a CERP or two, I think, for the time you spend preparing and presenting that material. That's really important. That's an easy way to get you a couple CERPs towards your 75. Make sure you're capturing, because there's no way to, you don't get a certificate for that stuff, but make sure you're capturing where you actually do that work and keeping record of it so that you can count it towards your 75. Keep an eye out. Always, there's always free CERPs available if you keep an eye out. Even at conferences, there may be a couple of sessions here or there that are available for free CERPs. So don't miss the opportunity wherever you can. Any other insight on that, ladies?
As far as attending the conferences, because I like to attend conferences, you know, when the world's open. I like to attend the conferences because that's when we get to meet and connect with people that we have these social media and email, relationships with. But sign up for the conferences and sign up for the sessions that are of interest to you, not just for the biggest, like the largest amount of SERPs. Because if you're just out here getting SERPs and you can't relate any of this or apply any of this information to what it is that you're doing in the field, then it's kind of like, what's the point? It's like taking some of those courses you had to take in high school that you really aren't using now in life. So I encourage people to do that too. Don't just focus on the SERPs, focus on the content. How is this going to better you as an LC? What are you going to bring back to your organization? What are you bringing back to your community? And so just making sure we're doing that too.
I love that. One of the ways that this was really demonstrated in my life was my good friend here, Nikki. For a while, you were on the Tethered Oral Ties kick. You went to every conference you could find.
Everyone. I love it.
That topic. What that showed to me was we need to be honest with ourselves, not just about what we like, what we enjoy listening to, but where is our gap? Where can we shore up some skills and knowledge to be able to better support our communities, and go for those opportunities to learn and grow so you can be a better asset to your community.
That right there, that's a whole word, as I say, Nikki.
Yeah. And that's how some people, it's not enough to just have your experience in that, but hoping that you're backing your experience with evidence-based information. And that's pulling in different techniques and resources from all across the world, y'all, because this is an international certification, pulling information for all across the world and really building yourself up, building up your arsenal of your toolbox of like, yes, I am the person that work with twins. But it's not enough that you only just, work with twins. Where's your, constantly refresh that information, because if you took that webinar 10 years ago, it's time to refresh it.
And that'll also help people find, because, we're talking about now that we've been in this profession for quite some time. And then I always tell people, get your feet wet first, and getting your feet wet is not like 6 months in, unless you've been doing work for some time and then you're just adding the certification. But trying to find your niche, like where is that gap? What is it that you are really good at? Because I always say everything that we do in life is for a reason. So we can take all of our past jobs and experiences, and then when you put culture in there too, this is who we are. This is what I like to do, and that will help you naturally find your niche instead of just jumping out here. Oh, my niche is like, low milk supply. That's fine if that's really what you're passionate about, but what if it isn't? Use these opportunities to get that knowledge as well.
Absolutely. I think there's also a really important reason to do this, in addition to the imperative to take care of your community better. But IBCLC has been pretty clear about, as time goes forward, they're going to give us a sort of a self-assessment to understand where some knowledge gaps exist, and they need to see those SERPs in those areas. They need to see us working towards closing those gaps. That's going to be a part of recertifying by SERPs moving forward. You don't just get to get 75 and all the things that you want, or go to one conference that's kind of focused on one area. There are some phenomenal ones out there, but please make sure that you're also working on staying current. That's a gap. Nikki highlighted the fact that this is an international credential. If your skill set is based upon folks who have double electric pumps, have access, have privilege, and you do not know how to support a person with hand expression, with limited means, that's a gap, friend. It's a gap. Please work to close that gap, so that if you are, not only in case you encounter families who don't have the means to use all the high-tech support, but also so that you can show that you are continuing to stay up to date on the knowledge for recertification purposes as well.
Definitely. And staying curious when you're looking at, okay, what is it that I don't know? Go look at that list and go take some classes, or go sit in on some seminars or webinars on that, because it'll be that one patient where you'll think back and be like, ooh, I should have taken that seminar. I should have gone to that webinar, because now you're faced with it head on. And how are you going to assist this client? So staying curious will also take you far.
Yeah. Setting aside time to do these things, because, you're like, oh, I know all three of us have purchased, come on now, a webinar. And we have still not looked at it yet.
Don't
And
talk
it's
about
I
expired.
know there's
maybe.
somebody.
that email. It's about to expire. It's about to expire.
Yeah.
You have it already. Don't be that. Set aside time. And Nikki will tell you, I'm good for a good personal work retreat. And not everyone can take it. I'm not saying take 3 days like I took, but when I'm sitting there and I make a list of all the things that need to be done, and I keep my list in Trello. So it's my project management type tool. And I have a list of all my interest areas. And then I try and find webinars to go along with that. And then I let it sit there. I hadn't purchased nothing. And then I go back and I was like, okay, my retreat, I'm going to take a day where I'm going to do continuing education. You have to be committed to it also. So you're truly absorbing it. Some people can listen to things in the background and say, oh, I got it, or doing while they're doing something else. I cannot.
I swear
Actually,
I can, y'all, but I can't. I swear I
I
can.
can't. It's not working. It didn't work. It's not going to work. It would never work.
I've gone
That's
through
why I
whole
can't do
audiobooks
Clubhouse.
and said,
I can't do
what was that
Clubhouse
book
because I
about?
just
Yeah.
can't focus.
You
So,
think
so
because we have all these.
Yes,
That's good.
Nikki, sorry.
No. I'm saying just set aside some time. You have to set aside some time. Just like we do other things. As you're going to a conference, you set aside that time. Set aside your personal conference time. You're like, I have 3 webinars. That's 3 hours. I'm gonna go ahead and listen to them, get my certs. And try and do it once a quarter where you have a conference day. We virtual. We're gonna be this for this year. And have your virtual conference day where you make your own little conference of things that you're interested in.
That's a nugget.
It's a fantastic idea. And I had never, when Nikki first told me she's having her retreat, I was like, where are you going? Is there a spa?
Me too. I was like, you're doing what? Where are you going?
She's literally locked in her office with
Yes.
food and water and
Mhm.
snacks, and in front of her computer. And it's the day she set aside to get work done, and she has it scheduled. She has a to-do list, and she can focus, and her family respects it because it's a day she's already planned out and let them know this is happening. And everything, the world is shut out, and she gets to sit there and tick through SERPs and everything else that she's been meaning to do for a quarter. And I think it's phenomenal. I got in on it recently, and we got to do lots of Nikki and Nikki planning. We got to plan out what we will share with you all for the next quarter, and things like that got accomplished. And I cannot imagine when else in my life or how else I would have been able to fit something like that in. So you have to be intentional about making time to get these things done, for sure.
Pre-planning.
Yeah. All right, we got a question before we leave continuing education. Let's see what the people are saying. It's a long question about sitting for the exam this year. Angela, go ahead and share it with us.
So I'm sorry, it's not about recertification. It is about sitting the exam for this year. Someone who is a pediatrician from Mexico, and their plan is to take the LER enriched course and register this April through Pathway 1 to take the exam in September. Does that sound like a good plan to you? Do you think I should pursue a different path? I just want to be successful with the exam and do it right away. Well, the first thing I would say as y'all are collecting your thoughts is that you need to have finished the 90 hours didactic and your 1,000 clinical hours. Fortunately, as a healthcare provider, you have your college courses, so you don't have to worry about that, but you need to have all of that completed prior to actually applying for the exam. I'll let you finish on that point.
I feel like that's a pretty steep goal. Not that you cannot achieve it, but I think it's lofty in the amount of time that you'll have to get that accomplished. I think that you may find yourself less stressed and more able to absorb the information and go at a pace that is much more reasonable if you extended it to taking the spring of 2022 exam.
And allows you time too, so it's not as rushed. Like Nikki said, you're able to absorb that information as well. Just because when we were talking earlier about how the exam is very black and white, but when you're practicing, especially in the role of a pediatrician, there's a lot of gray. And it's very difficult to not get the waters muddied as you're getting ready to prepare to sit for the exam.
Yeah, extremely hard. I would say that this is the same is true for nursing or anything like that, or before we take the exam. Like I just couldn't imagine working. However, I do know that's a privilege, and some people may not have that. But just trying to clear your mind. If you could do a couple of days before, even just to kind of flush it out, okay? All that paid. Don't think about that patient. Don't think about a real patient. Think about a exam patient, and just filling your head with that information. But definitely getting those hours ahead of time is smart.
Yeah, I'd also recommend, especially if you're in the hospital setting. Is that what they share? Their provider. What type of provider, Angela? Do you know?
A pediatrician, but doesn't say if they're in the community or hospital based.
That's okay. So as a ped, okay, which is different. I was thinking L&D nurse. As a pediatrician, I think you have the benefit of having seen the entire breastfeeding journey, which is a fantastic skill set. Having going into this field, I think lots of folks have a very limited scope. You know, they've only seen babies day 1 to 3. They've only seen babies in the community beyond the first week of life. And then I think you've seen folks. Oh, you are in a hospital ped. Okay. I still think you've had the benefit of seeing folks over the babies over the lifespan of the breastfeeding journey into extended breastfeeding, which is a really, really important piece to have under your belt. However, the more time and experiences you have working directly around breastfeeding, and not just in the normal course of your business, but focusing on dyads in breastfeeding, the better prepared you will be for the exam and for this work.
Yeah. I will say one caution, being a provider, is that we have to take off our provider hat when we're looking at this exam, because we will have a tendency to diagnose, and that is not what this exam is about. And that was a huge challenge for me, because the question would be like, oh, what do you do here? Well, I'm about to, this is mastitis, and you know, and have a whole treatment plan, and we have to pause and stop and understand the scope. That's what, and we'll talk about this in our live about mixing credentials. You have to understand when that scope stops and when another one, and sometimes there's overlap, but with this, it has to stop for this exam. You have to think about, push that scope over there, the pediatrician scope over there, and think about the IBCLC scope.
Which is interesting. I think just a little background for you, dear provider. This credential was created by folks who did peer-to-peer parent support, and so much of it, the questions are from the lens of counseling first, and making sure parent and baby are okay first before fixing, before the clinical, and that is a challenge often for clinicians. To shift their perspective when they take this exam. So I caution you to just take the time, settle into this more of a counseling space, and take the exam from through that lens. And it helps if you take some time shifting your perspective and looking at diets from that perspective before you go into the exam. That is my best advice. We have another question if we're ready. All right. Okay. I am a nurse, but don't have a job right now. Unfortunately, I'm off since COVID with my kids and homeschooling. I have L&D and postpartum background. However, I'm confused about what I need for education and hours. Can I volunteer with the Preceptor even if I can't get hired anywhere right now? Any ideas on how to do that?
So across the board, they mentioned that they're already a registered nurse. So they've got the prerequisites already knocked out. So you've already qualified for the prerequisites. And now it's just getting those 95 didactic hours. So honing in on those things. And it's different everywhere with trying to find someone to mentor you is what it sounds like. It sounds like it's like almost pathway 3-ish, where you're looking for someone to mentor you for those hours. So some pathway 3 preceptors do charge. Some people are, able to come into hospital spaces. Most are able to do home visits and clinic-based work. So it just is dependent upon what that clinical environment or arena looks like in your local area, or if you're willing to travel.
Yes.
We've also been recommending in this time, at least until September 30th of this year, IBCLC is allowing virtual mentorship. And so don't be afraid to reach out to IBCLCs who are not in your local area and say, hey, how can I shadow you? How can I do this virtually to get some hours out in the community with you, not being in person? There's a way. Also, please know that you can have multiple mentors. Get those hours however you can. And it really helps to have different perspectives from different mentors. We all do it just a little differently, a little different flavor, a little different focus, a little different communities. And the more varied experiences you can get, the better you can support your community in the end. So yes is a short answer. You can volunteer with someone while you're looking for work. And you can do that any number of ways. You can be really creative at this point about how you do that and who you do it with. All right. Oh, two more. All right, let's go. I'm going to read these questions. Y'all, co-hosts here today, please think through your best tips for longevity in the field. Angela, I'm ready for your next two questions while they're thinking.
Two real quick. So one question is, I'm a certified nurse midwife and I am more interested in pathway 3, having to get 500 hours because I wonder if it will be so long to do the 1,000 hours under pathway 1. Any thoughts?
Probably already got them hours, boo.
That's what I was.
You probably already got those hours. And I'm just speaking from a place of knowing midwives and what they teach. And they definitely do prenatal teaching with breastfeeding. They definitely do. I mean, you're there. You are the person there latching the baby on, especially if if you're doing home births or birthing center. So I'm guessing you probably have half of them, depending on how long you've been doing, at least half this year. So I would challenge you to go back into all of your scenarios and say, oh, we did do breastfeeding, we did do breastfeeding, we did do breastfeeding, and see what you got. What do y'all have?
And see who will come, what IBCLC will come along and help you to document those hours under them. Yeah, Janine.
That would definitely be nice.
Yeah, you're doing it already in your work. I also would caution you against against going for 5 instead of 1,000. It does sound like a lot. It is a lot of hours, but they're really useful. It really is important to get various experiences. And like I talked about with the providers who are used to day 1 to 3 of life, you probably have a great deal of experience immediate postpartum and prenatal. But maybe look for someone that you can shadow, getting some help, getting some experience supporting families that are a little bit further along in their breastfeeding journey. And common things they run into a little bit later on. They're looking, is my supply good enough? What happens with nursing a toddler? What do I do with all these teeth? All those things that come up a little bit later in the nursing journey. If you're looking to close a gap, I advise you to find someone who can shadow in that area.
And then tap into, depending on what setting you're in. My midwife and I talk about this all the time because this is exactly what she's thinking about. Do I do it the 1,000? Do I do the 500? And so, yes, as midwives, they can certainly assist families in infant, like the dyad for the first 30 days, as far as baby is concerned too. But what happens, like you said, with the toddler, what happens when you see those one-off, little funky things that you might see in an outpatient setting? So sometimes if she's in between, like she'll come running in and she'll be like, let me see too. And we can count those as hours.
Yeah. There's really creative ways you can go into relationships with other providers in your area. I urge you to look into that for sure.
One more quick one.
Wait, Angela, add that thought.
Go for it.
Angela is reminding us that the 500 hours is directly supervised while the 1,000 isn't. You want to elaborate on that, Angela?
Sure. So if it's 500 hours and you're working directly with an IBCLC, they sign off on those hours. Those are directly supervised by that IBCLC. If it's 1,000 hours, it does not need to be signed off on nor directly supervised. And so that's the reason why most healthcare providers will go through pathway 1 as opposed to pathway 3, even though it seems that 500 is less than 1,000. Yes, we can all do math yet. When you realize that supervision piece and getting a clinical internship with a pathway 3 mentor is quite challenging right now in general, as well as during COVID. So yes, do keep that in mind.
Those are the differences between pathway 1 and pathway 3 that Angela's explaining, folks who are new to this. If you're pathway 1 and you're getting your hours through being either a healthcare professional or a volunteer, those hours don't need to necessarily be one-on-one supervised. You just need to document how many hours you had serving dietes, breastfeeding support. It's different and an important distinction. All right.
5 years also.
Say it again.
Within the last 5 years. So you have to have had those hours within the last 5 years, because I mean, if you've been doing this 20 years, you're like, oh, I got it all. Nah, just 5. Just 5.
Yeah. Some components of the requirements are time sensitive.
Yes.
Luckily for me, those general education hours can be as old as the earth, like mine were. Many, many moons old. But your lactation education and your clinical hours need to be current. They need to be within the last 5 years.
Which totally makes sense. We want the most current information to be floating around in your head and in your practice, as opposed to that general stuff. I mean, yeah.
Biology is still biology, although we learned a lot about the anatomy of the breast in the last few years.
Exactly.
But you learn that in your lactation education and in your supporting families. You learn hands-on how the breast is different than previously thought and maybe taught by your biology teacher back in the day, which is fantastic. All right, we're going to pause from questions from the audience to talk about longevity in the field. How do you make sure you're still doing this thing and recertifying like Nikki next year? That you're not burnt out and like forget it.
I definitely say be a pre-planner. Do something bit by bit so that you're not trying to shove everything in all at once. And then making sure that not only are you staying relevant within the profession so that you are marketable, but making sure that you are clinically sound in the profession by staying up to date with what's current. What is evidence-based research saying? Because if you're just going off of, oh, this is what was happening 10 years ago, it's all the same, we treat everybody the same with latch issues, we know that that's not true. And so just making sure that you're always reinventing yourself. As an IBCLC, you should always be pioneering. You should always be growing. Like every 5 years, you should be, when you get ready to recertify, you should be able to mark, hey, did I grow? How did I grow? Every single 5 years.
I think that's fantastic.
Because, dang, now you got me over here thinking,
Did I grow?
did I stunt myself? Am I sure?
Nikki, what do you think? Longevity.
I agree. I think just constantly honing your craft. Like if you feel comfortable, I tell nurses this all the time, new nurse practitioners, new nurses, new IBCLCs, if something doesn't scare you, then you shouldn't even be in this. Like if you think you know it all, no, I don't want you messing with me. And because you have to have a slight bit of nervousness when going into these cases, because they're not textbook. Not everyone is the same. And I like that about it. I like that bit of excitement and nervousness and solving the challenge of solving a problem, but that comes with, and I push that anxiety down a bit to a nice manageable level, because of constantly honing on my skill, learning, challenging myself, taking criticism, being able to take that, please ask your clients, ask your supervisors, hey, is there something I'm missing? Like, how am I doing with this? And I ask Nikisha all the time, hey, I don't think I understand this correctly. Can you help me? Like, did I say that right? And you're like, let's tweak this. And we just feed off and having those conversations, going over case studies. That's why I love breastfeeding grandmas, because going over these case studies and looking at things and getting different perspectives for people, how they look at stuff and you've never thought about it from the perspective. You're just looking at the lens of IBCLC. You haven't gotten the perspective of what the speech person would say, or what the doula would say, or what the pediatrician, why they said what they said, and if we need to challenge it a bit, or things like that, or what the OB is telling them prenatally. You're like, you're not supposed to say that. So getting in community with folks from different spaces, don't just bottle yourself around lactation consultants. And that's one thing I learned early. I can't put myself in a box, because I'm a nurse practitioner. I have to see what are NPs actually telling folks. So I say, keep it variety, keep it that way.
I think that's fantastic. Yeah. I think my feedback is a blend of what both of you have shared. I think Jania really touched on the importance of staying sharp, keeping your skills sharp. One example that's really challenging me right now is what I was taught about thrush in Canada versus some newer studies that have come out about it. I'm challenged to shift some of the language I've been using with families for years, and that's just one way. And I wouldn't have come across it if I weren't in circles with other lactation consultants and talking about, hey, what are you saying to families now about this? Just today, I saw a post to one of the groups about how many stools are you saying families, should look for on day 4? And there was not consensus, because folks are still saying what they said 20 years ago. And some folks are saying what they were taught last year, and there's a little shift there. And it really helps to be surrounded by, as Nikki said, other professionals. Iron sharpens iron. And so you want to be around folks who can challenge you and stretch you and help you to grow. Some other pieces I have, another piece of advice I give is for folks like me whose work might look a little different. I don't do as much one-on-one support with families as I always did. And so it's important to me to, one, know that my work is still valuable. It's still important to have this credential and keep the credential fresh, even if I'm supporting the field in different ways, even if my work is shifting to equity training and helping us to be more inclusive in our practices. I still have to stay sharp in the way that I support families. Both is valid, both is important in the field, but it's also important for me to stay sharp with the way I support families. That said, I should also know when to refer. If I haven't seen a family with that issue in a long time, it's important to say, who else might be able to be a support to you, and to pass that on if it's not a place where my skills are particularly sharp. And I think that's important in staying relevant. It's important in staying effective in your community. You do not want anyone to walk away not being served by you because you didn't give them the very best advice. Angela, you want to chime in?
Thank you so much. Yes. So just a quick comment on how do you stay going and how do you, with the longevity piece, getting an intern. Take on an intern. They will keep you so sharp. They will ask you the questions. They will be the ones reading the research and reading the latest things, and they'll ask you questions and they will challenge you. And that's how you can grow. That's how you learn. That's how you stretch, is by mentoring the next generation, because we must mentor the next generation. Otherwise, we're not going to be here. And we have to see that those seeds within others that can do this work. And so please lift them up, bring them along. We need more hands to do this work. Thank you.
I love that insight. Y'all, Angela's been doing hospital and community work for, you want to share how many years? She's a real veteran.
Oh, Lord, 30 years.
30 years. Has a lot changed in our advice and approach to taking care of families over 30 years?
Everything. There's everything that has changed. And the day that I agree with you, Nikki. If this doesn't scare you, you're not learning, right? You're not on your game. And that's just so true. There have been times when I've walked in and gotten all sweaty and everything else because I'm looking at something and I just know that I am out of my depth. I need someone else. I need help. And I've been doing this for a long time. And I'm grateful for my colleagues and the people that I have met in this profession. That's what keeps me going. That's what gets me up in the morning, is the work that needs to be done.
I will share that Angela was one of my early mentors, y'all, real early mentors into this. And I certainly have called her, when we lived in the same city, I've called her in to attend some consults with me. Like, I can't figure it out. What am I missing with this family? And just because she's phenomenal, but also sheer experience, she's able to say, she is hiding some surgery she had. You don't see the scar, but something happened there. And, you know, she's able to alert me to things I wouldn't have noticed or wouldn't have as a newbie at that time. And so it really is so helpful to have someone that you can call in to give another set of eyes, give some insight, who's been doing this a longer time, and to her point, to continue to feed into the next generation of lactation supporters so that you are not left old and tired in your community and there's nobody to hand the baton to. Nobody wants that. Nobody wants that, you know. And yeah, we have an IBCLC in my town, but she's 97 and tired. She don't want to do this anymore, but she hadn't trained anybody else up. Like, well, who is that serving? Who is that serving?
Yeah, definitely.
And this just occurred to me. One thing with my NP certification is every 5 years, because I have the same certification, you know, recertify every 5 years, is that I take a review course every 5 years just to make sure that I have the basics clarified. I'm like, okay, do I have are we still using this medication to prescribe for, you know, like for hypertension and all these things? So my question is there that same level, not for like the new, but is there a review course for veterans, IBCLCs?
Angela, I'll let you tell about LER's recertification level.
That is so funny. Yes, we do have recertification, all sorts of things, but also we've got an exam prep that is, if I can say, I mean, it's really good. And the nice thing about our exam prep is that it gives you a very condensed way of looking at each one of the topics in the detailed content outline. Also, Sakita Lewis-Johnson, who's also with LER, she and I have done an exam prep. And so that is something which is recorded. It's free. It's on our website, so you can take a look at that. Also, and this is fresh, I didn't mention this to you earlier, but I'm probably going to be on either Facebook and or Instagram doing Ask the IBCLC. If you're nervous about taking the exam, you can just throw me any question that you want and let's try. You see, that's what keeps me happy and keeps me sharp and keeps me getting up in the morning. And so please do free Facebook, Instagram. It's probably going to be like on the 20th and the 27th, but we'll put those dates out there and they will be on our social media. So you'll see my face answering those questions. Y'all are welcome to join me. Nikki, Jania, y'all are welcome to join me if you'd like. I'd love the company.
I started sweating. Ask me anything's making me sweat. I don't know. I don't know what they're coming with.
Look at my textbook. Let me get this atlas. Hold on, y'all.
I'm like, are we gonna get the questions beforehand?
Oh no. Yeah. We have to be comfortable saying we don't know and referring to other providers who might.
Say, hold on. Look in the index.
But that's also a part of, you know, staying in this profession. I tell, you know, patients, I've told students, hey, I don't know, give me some grace on this. Let's look at what the evidence says together and we can all have a learning experience, because there are those one-offs. The human body is so amazing. And when you think about all the things that could happen in lactation, that goes into what you all were saying, not knowing it, humbling yourself to not know everything.
Humble yourself.
I'm going to humble myself and let you take that, Angela. However, if you need me, give me a shout, girl. I got you. We got you. This has been lots of fun. Angela, are there any other questions or any burning questions from the audience that we need to handle before we move on?
Someone just asked about how do you stay fresh with your evidence? Where do you go to get those resources?
Ooh.
A good one. I like, where's that book that, the Breastfeeding Answers book? I've been introduced to that colossal book. I really like that one. It has some great stuff. And then Academy of Breastfeeding Medicine. I seem to, especially if I need evidence to give to a provider. Because I feel like, you know, it's the Academy of Breastfeeding Medicine. And so I use that. And LER always has different things, you know, posted. We can't go off of every article that we find on Facebook, folks.
Right.
We have to make sure there is evidence that is a journal that we know, and not the root or anything. So we need to make sure that we're using the right sources.
And then I look at, subscribe to the Journal of Human Lactation, and this sounds crazy, but sometimes to unwind, I look at what's the newest research out there and go through these articles as I'm getting ready to go to bed, because I'm like, I need to know what else is out there.
Yes.
I think you have highlighted an important skill that the skill that's very important to have in this field is to understand research studies, to be able to read them and parse through what they're saying. And it's a learned skill. There isn't necessarily a path for learning how to read research and getting to this credential. Many of us got it through some of our general science courses and the path that we took to get to the credential, but it's not inherent or intuitive in the process. So learn how to read those studies, learn how to interpret them. Start at the abstract. It gives you the what's the top line. It gives you the so what. And then, but also it's really important to learn how to dig into them and parse through what they're telling you, because they're not always saying what the headline on the article may tell you they're saying, for sure. And also you want to know who funded the studies, because they may be leaning toward a perspective.
Yes.
I'll say that.
From the abstract, I read the back, and then if I would like to proceed, I go for it.
And if you want more info, look at the bibliography.
Yes.
Start from the back.
Start from the back. Anything they've declared, shared in those notes, you want to know, like, who that gives you a hint of who's influenced the work. I definitely, shout out to LER. Shout out to LER for continually having fresh courses available by leaders in the field who know their stuff for sure. And we work really hard to make sure that the content is fresh. If you catch something that's not, we probably are already trying to replace that. But feel free to let us know, and y'all do.
Yes.
Love the book Nikki talked about. That's Nancy Moorbacher's book. And I keep fresh by staying in circles of folks who are sharper than I am, staying aligned with folks who are smarter than I am, and keeping me on my toes all the time. I think that's it. Unless anybody has anything else they want to share. We want to thank Jania.
Thank you.
Thank you for having me. I had a great time.
We enjoyed you. Listen, y'all, if y'all remember back our last How to Become an IBCLC, we had someone who recently graduated from a Path 2 program, Marinike, and she was one of Jania's students, right?
She wasn't one of my students. She was one of the UNC students, but I assisted her with some of the learning that she did didactically.
One of your mentees, we'll say.
We can say I've taken her under my wing now. That's across the street from me.
There you go. So thank you for clarifying that. But it's a full circle moment to have someone who was influential in Marinike's path to come back and share now your wisdom from a veteran's perspective. So we appreciate you. Do you want to tell anything about your program? You want to share with the people?
We are getting ready to bring in our second class. Our first class is getting ready to finish in 2 weeks. In 2 weeks, I'm very proud of them. They are going to make wonderful lactation consultants. I always tell them, you don't have to stick to inpatient, outpatient. You can go into policy procedure. You can go into research. And I think we're going to see a little bit of everything from our first cohort.
So exciting. Congratulations on bringing through a whole cohort. That's fantastic.
I'm going
to have a 100% pass rate, 100% exam pass rate. Mark my words. I know it.
Like 100% pass rate. You guys just remember, we're going to do 100% pass rate. They're probably watching like, oh gosh.
Y'all, no pressure, but all of y'all better pass.
I tell them all the time, I'm like, no pressure. No one's watching.
Thank you so much, Jania. Thank you. All the love to you and your students and the great work that you're doing. It is so important because your work is at an HBCU, which is a historically Black college or university, and you are helping to equip the field with more lactation providers of color. More on that, April 28th, Nikki and I will be back with our next topic. It's equity in lactation, allies, advocates, and activists. Which are you, if any? You'll find out here. We will see you same time, same place, April 28th with that topic. Anything else you want to say, ladies?
No, stay safe and stay still.
And self-care.
and self-care.
All those S's. Yes. We love y'all. Thank you. Be safe out there. Take care. We'll see you next time.
Bye.